I heard you speak a couple of weeks ago, and you talked about MDMA-assisted therapy as being like getting to the root of the trauma, whereas a lot of what the existing treatment does is more or less just trim the branches. Could you explain what you meant by that?
Okay, so I have come to the field of MDMA-assisted psychotherapy as a research topic through my experience as a clinical doctor trying to treat PTSD, and coming to the realization that the majority of the treatments we use are what I would call maintenance therapies. We paper over the cracks by treating the symptoms. If someone's depressed, give them an antidepressant. If they can't sleep, give them a hypnotic. If their mood goes up and down, give them a mood stabilizer. So I have patients who come in on long lists of medications, all of which treat the symptoms, but don't actually treat the root cause being the trauma that for most people with PTSD arises quite early in life, often due to child issues. So the analogy I make is that MDMA therapy is like an antibiotic that treats the root cause. So if you imagine having an infection due to a microorganism, you can take a paracetamol that will lower your temperature symptomatically, make you feel a bit better. But paracetamol is not an antibiotic. And similarly, when we take antidepressants and the like for PTSD, we treat the everyday symptoms, but we're not treating the infective cause, if you like, the trauma.
Yeah.
But MDMA therapy is an opportunity to do just that, not treat just the overlying symptoms, but treat the underlying cause.
And you don't just obviously give out the MDMA as a drug, do you? It's part of a therapeutic process. Could you just briefly describe how it actually works?
No, you certainly don't just give out the drug. This is why it's the antithesis of current treatments, where you take these current treatments every day, day in, day out for decades, just to mask the symptoms. MDMA therapy, really, we focus on the MDMA bit, but really it's just an effective course of psychotherapy. So in a course of, say, 10, 12, 8 sessions, weekly sessions of psychotherapy, 2 or 3 will be MDMA-assisted, and they will be all-day sessions, interspersed amongst non-drug therapy sessions in which you talk about the material that comes out on the MDMA.
And what is it about MDMA as a drug that is so effective at helping trauma survivors to confront what happened to them safely?
So I wrote a paper a few years ago called something along the lines of, if we were to invent a drug to treat trauma-focused psychotherapy, it would be MDMA. It appears to tick all the right boxes due to its very unique receptor profile. So at one level, it's increasing your mood and lowering depression and anxiety, which is important. It has a mild stimulant effect, which encourages the patient to engage in therapy. But it has a paradoxical, at the same time, relaxation effect. So that treats the hypervigilance symptoms. But its main effect really is this capacity to induce empathy. It allows the patient to engage with their traumatic memories that normally overwhelm them. So most people with PTSD, they'll do anything but think about that particular day, that particular incident. They'll do anything. They'll blunt their feelings with heroin or alcohol or self-harm or suicide. All of these dangerous behaviors, basically to do anything but go there. And then on MDMA, they can go there. They can spend many hours talking through their painful memories without being overwhelmed with the normal fear response that goes with recall of those memories. So it allows a person, for the first time in their life, in many cases, to be with their trauma and talk it through.
I'm going to risk causing you a huge amount of irritation now by asking the question that I know you get asked a lot. Isn't this just like taking ecstasy?
So we have to be very careful to not infer what we know about ecstasy use and put that onto clinical MDMA. It's not at all like taking ecstasy. Ecstasy is whatever, I don't even know what ecstasy is these days. It's whatever dodgy club you buy some dodgy pill off some dodgy geezer, may or may not have MDMA, plus or minus many other possibly far more toxic substances. So for a start, the medicine we use is 100%, well, 99.98% pure MDMA. But it's the way in which it's delivered that makes it so different. When one takes ecstasy, it's all about externalizing the behavior, dancing, shouting, taking alcohol, lasers, loud music. So when one takes it clinically, you lie down in the dark with eye shades on and music with your therapist, and you use the energy of that substance to go inside and be with the trauma. Very different from ecstasy. And also, the risks that might be associated with ecstasy use can be reduced to a bare minimum when it's used clinically.
So where do we stand in terms of clinical trials and actually making this form of therapy widely available in the UK?
Well, at the moment, MDMA does not have a medical license. It's a Class A banned substance. So we need, when we do the studies, we need to apply to the Home Office for approval to do them. And it's the same anywhere in the world. There's nowhere in the world where MDMA is licensed yet. We're looking at around about the next 3 to 5 years to get the studies completed around the world and see MDMA licensed as prescription medicine. But then, even when it is licensed, it's not going to be the sort of medicine that you can get from your doctor and then take home. It will only be, the license will be tied to having to receive it in a particular setting with a therapist.
Well, it sounds like it has potentially revolutionary clinical applications, perhaps for many people who have proved unable to benefit from our existing paradigm. So what do you think this could do in terms of transforming, if you will, the way we approach trauma?
Well, absolutely. I mean, the thing that interests me about PTSD is the 50% treatment resistance. The fact that for 50% of people, the current treatments are just not effective. And I think that's for a number of reasons. I mean, mainly because with all of those masking medications they take on top, the antidepressants, etc., when it comes to psychotherapy, asking that question, tell me about your rape, tell me about your assault, the patient flees. They drop out of treatment, they turn to drugs and alcohol, they have severe dissociative episodes because they just can't do the therapy. So it offers the opportunity for that 50% group to sit down with their therapist for the first time and do the work. So this could have really profound implications, because the trouble being that for 50% of people with PTSD, the disorder becomes a lifelong chronic disorder and they don't respond to treatments. So if we can in any way have a meaningful effect on that other half, then we're going to be doing some good things.
Well, it sounds fantastic. I'm going to put some links at the end of the blog to some more of your work for anybody who wants to find out more. Dr. Ben Sessa, thank you very much.
Thank you. Good luck.